Good evening, everyone. I'm Keishla Adderley, and welcome to the Bahamas Tonight, the National Report. Thanks so much for joining us. Topping news this evening, there are now 54 confirmed cases of COVID-19 in the Bahamas. Health Minister, the Honorable Dr. Dwayne Sands, held a press conference this evening announcing those new numbers and where there are mortalities, what led to them. Our Jimenita Swain joins us live in studio with full details. Good evening to you, Jimenita.
Good evening, Keishla, and good evening, Bahamas. Health Minister Dr. Dwayne Sands confirming one additional case of COVID-19, pushing the country's count to 54. However, 9 people have died as a result. The Health Minister providing more insight about those patients.
Case number 17, a 67-year-old female from New Providence. Number 18, a 72-year-old male, also from New Providence. Number 20, a 91-year-old male from New Providence. Number 21, a 57-year-old female from Bimini. Number 22, a 79-year-old male from New Providence. Case number 23, an 80-year-old male from Grand Bahama. Number 31, a 50-year-old male from New Providence. Number 40, a 51-year-old female from Grand Bahama. And number 41, a 56-year-old female from New Providence.
Well, health officials plan to wrap up testing by the weekend of groups that include contacts of active patients, nursing home patients, persons in prison, and healthcare workers. But Dr. Sands noted underlying health conditions play a key role.
COVID-19 confirmed deaths are 6.4 times more likely to have comorbidities or underlying medical conditions. Our surveillance team will continually pursue contact tracing for persons who were exposed to the COVID-19 cases. To date, we have identified 892 contacts through our contact tracing system.
The health minister also shared how patients are tested for COVID-19.
Be inserted into your nostril, fairly deeply, I might add, into the nose, and a separate swab inserted into your throat. The swab is then placed in a tube and transported to the National Reference Lab for RT-PCR molecular genetic testing. At the lab technician extracts the RNA, or the genetic material, from the swab sample.
Well, of those 54 cases, currently 10 persons remain in hospital as a result of COVID-19 with additional testing. Officials know that more cases will present. They just hope that they are not as severe as in some instances that required hospitalization and even death. Back to you, Keishla.
Thanks a lot. Our Jimenita Swain reporting.